I'm very excited to present our work on development and task-based evaluation of a scatter window projection and deep learning-based transmission-less attention composition method for myocardial perfusion SPECT. The presentation has 5 parts, and I will start with the first one. SPECT is a widely used nuclear medicine imaging modality in myocardial perfusion imaging. In a myocardial perfusion study, patient is injected a radiotracer, which emits gamma photons. A part of the gamma photons are scattered in the patient body and not detected by the scatter detector, leading to attenuation artifacts. Attenuation of photons is a major imaging degrading effect that adversely impacts image quality in SPECT. And attention compensation is beneficial for visual interpretations of myocardial perfusion SPECT images. Traditional attention compensation approaches require an attention map from a separate CT scan. However, this method has several disadvantages. First of all, most SPECT systems do not have a CT capability, including SPECT systems in small company hospitals and physician's office, solid-state detector-based SPECT systems, and mobile SPECT systems. Even there's a SPECT system with a CT component, there are still some disadvantages. Having a separate CT scan leads to increased radiation dose and higher scanner costs. More importantly, misregistration between SPECT and CT images leads to inaccurate diagnosis. Thus, there is an important need to develop transmission-less attention composition method for SPECT. Recently, multiple deep learning-based transmission-less attention composition methods for SPECT have been proposed. Those deep learning-based methods are divided into 2 categories. The first category is the direct strategy, where attention compensated SPECT images are directly estimated from non-attention compensated images. The second is the indirect strategy, where attention maps are estimated from the non-attention compensated SPECT images. Shi et al. Proposed a deep learning-based transmission-less attention compensation method for SPECT that estimate attention map from SPECT emission data. And in a previous study, we have demonstrated that scatter window projection contains information to estimate the attention distribution. Based on those previous studies, we developed a scatter window projection and deep learning-based transmission-less attention compensation method and objectively evaluate the method on the clinical task of cardiac defect detection. Then I'm going to introduce our proposed method. In this study, we provide a theoretical proof that scatter window projection is functionally related to the spot of regions in the attention map. The problem of estimate the attention map can be proposed as a segmentation problem. However, segmentation in projection space is non-trivial. Thus, we reconstruct the scatter window projection using a physics-based approach to obtain an initial estimate of attention map, then segment it into different regions. This is the overall workflow of our proposed method, namely the SLECT method. We first collect the projections in photo peak energy window and scatter energy window. Then we used an OSM-based reconstruction approach to reconstruct the projections. Next, we used a segmentation network to segment the initial estimate of attention map, and we assign different attention coefficients into corresponding regions. Finally, photo peak energy window projections were reconstructed by an OSM-based attention composition method with final estimate of attention map yielding the activity reconstruction. Then we are going to evaluate our proposed method. Deep learning-based transformation-less attention compensation method for SPECT have typically been evaluated using fidelity-based figures merit. In our study, the SLAC method was firstly evaluated using fidelity-based figure merit, including root mean square error and structural similarity index. However, clinical translation of this method requires being evaluated on clinical tasks. Studies have shown that evaluation of deep learning-based medical imaging method using fidelity-based figure of merit may not correlate with the performance on clinical tasks. Therefore, the SLAC method was also evaluated on the clinical task of detecting cardiac defects in a retrospective study. The SLAC method was compared with a standard CT-based attention compensation method, namely CTAC method, and a no attention compensation method, namely NEC method. The evaluation study have 4 parts, and I will start from the first one. In our dataset, we have around 3,000 patients with myocardial fusion studies. We collect the patient with photopeak energy window projection, scatter energy window projection, CT images, and clinical reports. In total, we have 648 patients. In the test dataset, we have 140 patients. To get access of the ground truth, we designed 27 types of defect with different extents, severity levels, and locations. And we insert the defects into SPECT projections. The rest of 508 patients are used for training. The network was trained to minimize weighted cross-entropy between predicted and CT-based segmentations. 5-fold cross-validation was implemented. In the test dataset, we have 3,780 3D images. We use the SLAC method to obtain activity reconstructions. Next, we reoriented and filtered these images into short axes. Then we are going to extract task-specific information from those images. As mentioned earlier, the SLAC method was evaluated on the task of cardiac defect detection. We used a channelized Hamiltonian observer with rotational symmetric frequency channels. This model observer has been proved that can emulate human observer performance. We used a leave one out strategy and obtained the test statistics. With these test statistics and using LabRC4 program, we conduct RLC analysis and calculate the AUC. We also evaluated the SLAC method on fidelity-based figures of merit, including root mean square error and the structural similarity index. To investigate whether the SLAC method is at least as good as the reference standard CTAC method, we conducted a non-inferior test among different methods, where difference in AUC was calculated and compared with a predefined margin. Here are some results of our evaluation study. The fidelity-based figure of merit demonstrated that the SLAC method significantly outperformed the NEC method. And the RC curve obtained by the SLAC method was almost overlapped those obtained by the CTAC method. The AUC obtained by the SLAC method was similar to the CTAC method. The non-inferiority test demonstrated that the performance of SLAC method was non-inferior to the CTAC method within a margin of 5% of CTAC obtained AUC. We also evaluated the performance of the SLAC method in different sexes. In male patients, we observed that the performance of the SPECT method was non-inferior to the CTEC method within a margin of 6% of CTEC obtained AUC. And we observed the same findings in the female patients. Here are some representative examples. The attention map obtained using SPECT method were close to those obtained from CT images, and the SPECT images obtained using SPECT method were similar to those obtained using CTEC method. The right side is a defect percent example. We can find that the same defect was shown in CTEC obtained and SPECT obtained images. In conclusion, we developed a scatter window projection and deep learning-based transformation-less attention composition method for SPECT, and objectively evaluated this method using a retrospective study with a model observer. The method was statistically inferior to a standard CT-based attention composition method on the task of detecting myocardial perfusion defects, with the AUC difference within a predefined margin of 5% of AUC obtained by CT-based attention compensation method. Finally, I would like to thank our collaborators and funding agencies.